Hi, my name is Dr. Michelle Powell at Powell Health Solutions. I'm here to speak with you today about medical marijuana. Recently, the state legislature of Florida has allowed physicians who are qualified by taking 2 hours and 8 hours credits in understanding medical marijuana to be able to provide medical marijuana as an alternative treatment for certain medical conditions. These medical conditions are clearly stated in the Florida law that will qualify for treatment. These conditions are: you have AIDS and HIV, you have cancer, Crohn's disease, post-traumatic stress disorder, multiple sclerosis, Parkinson's disease, Lou Gehrig's disease, as well as any other qualifying conditions related to pain as it relates to having had cancer. Now let me be very clear. The qualifying conditions, separate from the above named, when we're talking about pain, has to be related to cancer. And I make this differentiation because this is a new understanding of the law that was generated in December of 2017. Additional qualifying conditions for the medical marijuana program is Parkinson's disease and glaucoma. In addition, you will also have to obtain a license provided by the state, in which you have to complete an application, which is $75, have a passport photo taken, which will be included in your application. But that's not enough. You need to meet with a physician, such as myself, who will do a physical examination, review your medical records, and determine whether or not you qualify. You may have the conditions that should qualify, but you must be certified by a physician who deems it necessary, which means you meet a criteria that you've tried other ways of treating your condition and they have not been satisfactory or have failed. When you try to qualify for the medical marijuana program, it's really important that you understand what that will mean and what your expectations should be for the program. Medical marijuana may assist and alleviate a lot of your pain. It may help with migraine headaches. It may help reduce seizures. And it may, if you have multiple sclerosis, alleviate some of the symptoms that you may be experiencing. Or it may not. This is another modality that can be used to help. There's no guarantee that this will cure or treat the condition for which you're looking, but it is an alternative treatment option that is available not in every state. Florida is one of those states that have met qualifications and have passed by the people of Florida to allow it to be considered a medical condition a medical treatment option for certain conditions. So what does that mean? If you become qualified in the state of Florida, you can go to California where it's accepted, Colorado, but you may not be able to go to maybe Mississippi or other states. So you will have to ensure that you meet the criteria for those states if they have it. One state qualifying you does not mean you qualify for another state, even though they offer medical marijuana. It's very important for you to understand that medical marijuana as a treatment option cannot be your first line. It cannot be your first pass. You will have to show, that is why you meet with a physician, that you have tried other options, other modalities, and not been successful, and are still in pain or have not having your condition treated or adequately taken care of. So medical marijuana should be used as almost a final resort, a final option before maybe having severe significant surgery or just settling for a debilitating condition. In the practice of Powell Health Solutions, we utilize medical marijuana as a treatment option, as a treatment addition, as an additional modality. Here at Powell Health Solutions, we treat the entire person. Not only will we be looking at your condition, we'll look at you as an individual, your lifestyle, the current medications that you're currently using, how they may engage or interact with the medical marijuana. As well as we'll look at your medications to see, are they helping you? And maybe we'll make adjustments to your current medications. And that will be a purpose for an evaluation by me, the qualifying physician. You need to set up an appointment to be seen. Bring $75 for your certification to be sent to the state of Florida with a passport photo. Bring any medical records that you have supporting your qualifying condition. And then meet with me, perform an examination, and you're going to attest also that you understand that this is not a cure-all, that you understand that it's not legal in every state, and you understand that it may not be a treatment for your medical condition. Do I recommend medical marijuana? Most definitely as an alternative treatment option for individuals who have not been successful with other programs. Why? Why would I recommend medical marijuana? After careful research, investigation, and I really looked into this as an option for patients. One, medical marijuana tends to not engage or interfere with many other medications. Therefore, you can utilize it with your current medications for other conditions. Secondly, while you can have dependence, it causes less dependency as many other forms of narcotics and controlled substance that I myself prescribe and many other physicians prescribe, without the side effects that you will see utilizing a narcotic or other controlled substances. And finally, I believe that in attaining cure or comfort, or at least allowing individuals to lead a very qualified life where they can take care of themselves, is of utmost importance. The mind, body, and spirit being able to take care of oneself so your life is optimized is what Powell Health Solution is all about. And any way that I can assist you in living a healthy and happy life, I would like to try. One of the interesting questions that a lot of people think about, especially family members may come and ask of individuals who are utilizing or seeking to utilize medical marijuana as a treatment option. Am I going to be addicted? Is this going to lead me to want to use more drugs? Am I going to be one of those people who are drug seeking or become dependent or go into heroin or other stronger drugs? Marijuana in of itself is not considered what we call the gateway drug per se, as maybe alcohol and other narcotics and other drugs. It is a drug that you can become dependent on, that is true, but is less likely than other drugs to lead to heroin use or any of the other illicit drugs. Medical marijuana is not covered by insurance. The examination, your physician's visit, nor the medication itself will be covered. So you have to be prepared that you'll be paying cash for this until insurance see it as a viable option that should be covered. Oftentimes it can take years, so be prepared to have a budget set aside for this program. One common question is whether or not you'll be able to obtain your medical marijuana treatment here at Powell Health Solutions. Actually, all medical marijuana treatments must be obtained at what is called a dispensary, which is a location almost like a pharmacy, but specialized and licensed to distribute medical marijuana. Physicians' offices are not licensed to be dispensaries at this present time. So what you'll obtain from me as a provider, qualifying physician, is a prescription that will be sent electronically. Once you have your license and are legal and able to obtain the medical marijuana, the dispensary will see your prescription and fill it. You contact the dispensary and they will arrange for you to either pick up the medication or it be delivered to your home. The medical marijuana comes in a number of different forms. It can be obtained as a vapor, It can be given as drops that you can place under your tongue, or you can also use this as a tincture, which is a oil that you can place on your skin. The recommendation at this time is for vapors and drops under the tongue. Medical marijuana, in order to be prescribed medical marijuana, you have to meet the qualifying conditions. Even though medical accidents and severe disabilities does cause pain, the qualifying condition is not strictly pain. It must be what we call it under the qualification, such as post-traumatic stress disorder, or a qualifying condition such as pain from having had cancer. But having had an accident where you slipped and fall, have a sustained chronic back pain, is not considered a qualifying medical condition. One question often asked of me as a provider that is able to write for medical marijuana: how does it compare to drugs like Percocet or oxycodone or Norco? How does it compare for treatment? Well, one thing to understand is that oxycodone and other opioids, as you know, we're in what we call an epidemic where people are overutilizing those narcotics to treat their pain. We have found that individuals who utilize medical marijuana, even though they still may use their opioids, they're using it less and less. And the goal of the program here, especially at Powell Health Solutions, is to decrease the amount of controlled substances and narcotics or even pain medications that you will need. And the only treatment will be your medical marijuana, used 1 to 4 times per day. Again, we want to get away from drugs such as narcotics that can cause constipation and can cause severe addiction and dependency, and has severe adverse effects when they interact and engage with other medications that can lead to death and brain damage. Will you be on a program utilizing medical marijuana for the rest of your life? As long as the condition for which you're utilizing the medical marijuana exists, it is likely that you'll be taking that medication, whether it is medical marijuana or whatever treatment modality that you're utilizing for that condition. We hope and are hopeful that in the future, the qualifying conditions and many more will no longer exist as science advances. I look forward to that time. One might ask the question, how does medical marijuana differ from what I can obtain on the street, or maybe in some stores that are selling so-called THC and so-called medical marijuana-like medications? One of the things to understand with the medical marijuana, you have to go through very strict process, similar to what is required for any drug that is marketed to the public as a prescription medication. In addition, the dispensaries and the growers for the medical marijuana must undergo inspections, rigorous inspections. So what you're getting separate and different from what you get on the street is purity and understanding and knowing that the medication itself has been screened and is found to be pure. Unlike what you will find on the street, where you have no idea what may be included in that drug that you're obtaining. I do not recommend individuals to obtain marijuana or any other substance on the street. Prescription medical marijuana should not be utilized while driving a motor vehicle or any other automated car, bike, or any vehicle. It should not be taken or utilized around schools, and certain government institutions will not allow it on their premises. You'll have to determine and find out from your employer, if you're still working, whether or not you can utilize medical marijuana on their premises. Anyone who does have medical marijuana should carry with them their card which states that they are qualified to have this drug in their presence. Understand that if you have drug testing at your job, they will actually find marijuana within your urine or in your blood. Let me repeat that. If your job or employer requires drug testing, medical marijuana will, like any other drug, show up in your urine or in your blood. It's imperative and important that you find out and notify your employer whether or not they allow medical marijuana on their premise or in their place of business. If you're an individual with any of the qualifying conditions we have discussed today and would like to find out if you qualify for medical marijuana, see us at getyourmedicalmarijuana.com and book your appointment today. We'd love to try to assist you in obtaining a more quality of life.